Nice to meet you. I'm Dr.
Hi,
Johnson.
I'm Kelly Holmes.
And I'm Dr. Graham.
Hi.
So this morning I'd like to start with the first case. And we have a 53-year-old woman who presents for healthcare maintenance. Do you do osteoporosis screening?
Yes, I do, for all postmenopausal women that have risk for osteoporosis or fractures.
And how do you screen for osteoporosis?
Routinely, if they're age less than 65, I tend to I base it on history and risk factors. Otherwise, patients over 65, I do the DEXA scan and bone mineral density testing.
What would you consider risk factors?
Risk factors include previous history of a fracture, smoking, long-term use of glucocorticoids, low BMI, Caucasian race.
Anything else? Are there any other risk factors you might consider?
Yes, if they have excessive intake of alcohol.
Okay. A 66-year-old woman has a T-score of minus 2.6 on a DEXA scan. What is your management?
So I would consider her with a diagnosis of osteoporosis. And I would initially talk to her about her nutritional intake of calcium and vitamin D, as well as her exercise regimen. And if she is a smoker or does drink alcohol, I would encourage cessation.
Why would you consider her to have osteoporosis?
With a T-score of negative 2.6 and her age being 66, that's a diagnosis of osteoporosis.
How much calcium and vitamin D do you recommend for your patients?
Daily intake calcium would be 1,200 milligrams per day, and that includes her dietary intake. So, for example, if she has 400 milligrams in her diet, I would recommend that she takes 800 every day. With regards to vitamin D, it's recommended that she have 800 international units per day.
Okay. Are you going to start drug therapy for this patient?
Yes.
And what would you start?
For her, she would be a good candidate for bisphosphonate therapy.
What are the contraindications to bisphosphonates?
Most people tolerate bisphosphonates well. However, it would be important to make sure that she has renal sufficiency, thus having a creatinine clearance greater than 30 mils per minute.
Are there any other conditions under which the patient would not take a bisphosphonate?
If she had any known allergy to the medication or upper GI issues or an esophagitis, it would be contraindicated.
What bisphosphonates do you use for this patient?
Normally, I prescribe alendronate or risedronate as my first line of therapy.
How do you monitor the patient's response to this therapy?
After 2 years, I would have her do a follow-up bone mineral density test and DEXA screen. But in the meantime, I see her clinically and do history and physical annually.
Follow-up DEXA scan shows the T-score of minus 3.0. What is your management now?
First, I would check to make sure that the patient was actually taking the medication in compliance. However, a worsening T-score does indicate that her osteoporosis is worsening, and or the bisphosphonate is not, or she's not responding well to the bisphosphonate therapy. Other alternatives would include IV ibandronate or IV zoledronic acid. We could consider a parathyroid hormone or denosumab.
How does denosumab work?
This inhibits osteoclasts by binding to the rank ligand.
Do you use hormone replacement therapy for osteoporosis?
No, not routinely. It's not my first line therapy. However, or actually this is not a good therapy for this patient because of her age.